Tonight at 6, we dive deeper into why a nurse is quitting after 2 decades of service. Good evening and welcome to ABC Action News at 6. I'm Lauren St. Germain in for Wendy tonight.
And I'm Jamison Euler. Tonight, that exclusive interview with a former Bay Area ICU nurse. She's
speaking only with ABC Action News reporter Isabel Rosales about the changes she says the hospital needs right now to turn this around.
You're about to hear from a nurse who routinely worked the COVID positive unit here. But this week she sent in this letter of resignation and along with it a list of reasons why she thinks the hospital is putting her colleagues and patients in harm's way. Stephanie Davis is pushing for changes at her former employer, Bayfront Health St. Petersburg.
It's bad. Yeah, the staffing is horrible. It's not appropriate and it's not safe for the patients.
She says many of her fellow nurses are out sick with the coronavirus.
There are more than 14 ICU nurses that are sick right now. We're having a containment problem within the hospital. It's obvious.
ABC Action News got a hold of this internal memo sent 2 days ago. It shows a total of 21 staff have tested positive since mid-May.
Everybody's sick. We don't have enough people to take care of the patients, and we're concerned about patient safety. And yet, when we voice those concerns, it's met with nothing. Like, you're silenced.
Davis says she and others are frustrated by a lack of action. It's gotten so bad, she says, instead of their usual 2 patients, nurses are having to triple up. She calls it unsafe and a move that may cost patient care.
It makes you feel like a non-human. It makes you feel like a non-person, like disposable, just like the mask.
ABC Action News spoke with 3 other nurses who currently work at the hospital. They were too afraid to come forward, but they express the same concerns. In her letter to the hospital, Davis is also asking for improvements in access to PPE like N95 masks. She says nurses use them
until it breaks, it's soiled, or 5 shifts.
And after their 12-hour shift,
put it in a brown paper bag so you can use it again.
In this memo, the CEO lists out measures they're rolling out to help with these, quote, staffing challenges, including working with an agency to bring additional staff set to arrive over the next 2 weeks. Davis says this is a start and hopes it never gets to this point again.
If this is tolerated and this is okay and nurses don't have the right to be heard about patient safety issues, then I am in the wrong profession.
In St. Pete, I'm Isabel Rosales, ABC Action News.
We just got this response from Bayfront Health St. Pete. The hospital says the health and safety of every member of the team is very important to them. They also said, quote, our hospital has had sufficient PPE supplies throughout this public health emergency. 24 employees have tested positive for COVID-19. The hospital says while staff illness has created challenges, they are working with an agency to bring in additional nurses for coverage beginning on Monday. We will be posting the full statement from Bayfront Health St. Pete on the front page of our website at abcactionnews.com.